Now, the world-class THISDAY Dome testing, tracing and treatment center situated in the central business district in Abuja is going to be inaugurated today. The Minister of Health, Dr. Osage Hanire, announced this at the daily briefing of the Presidential Task Force on COVID-19 in the nation's capital. The treatment center is fitted with wards and ICU center complete with ventilators, X-rays and dialysis machines. Other facilities include 54 gene testing mobile lab complete reagents and a scalable ability to perform 200 to 1,000 tests per day. In addition, it boasts of a rapid tracing app for COVID-19 contact tracing, as well as a 98-room hotel and conference center for medical staff for 6 months. The Secretary of the Federation, Boss Mustafa, praised the private sector-driven initiative powered by THISDAY Media and Technology Group and the Sahara Group. The project is supported by the coalition, the Private Sector Coalition for COVID-19 against COVID-19, the African Finance Corporation, the Chinese Civil Engineering Company, CCCC, the Nigeria National Petroleum Corporation, NNPC, and the Central Bank of Nigeria. Donors to the project are Egbin PLC, the Wood Factory, the Regent Schools, Abuja Electricity Distribution Company, and Ebewele Brown Bespoke and CRE Clothier. Others are Mama Class, Traffic Flow, Urban Cuisine, Phase 3 Telecoms, and Canal. Let's take a closer look.
We hope to commission the THISDAY Dome Treatment and Isolation Facility. It will add a total of 270 beds to our capacity in Abuja. This is a private sector-driven initiative, and we commend the efforts of THISDAY and its proprietor, the NNPC, Sahara Energy Group, CCECC, and all the partners involved in this enterprise.
The THISDAY Dome Treatment Center, as the SGF has said, is a project of the Coalition Against COVID-19 and is complete, ready for commissioning. The Honourable Minister of FCT will participate in the event. The center is fully self-contained. It comes with its own PCR laboratory and a fully equipped ICU unit and an incinerator to destroy medical waste. Over 250-bed facility adds a tremendous boost to the capacity in the Federal Medical Center.
Well, I mean, we took this subject about a week ago.
Yes.
I think it's still in order to thank the chairman of THISDAY and Arise Media Group.
Absolutely.
For this act of generosity, of kindness, for his patriotism, for his public spiritedness, and to also thank all the members of the donor collective and all the other organizations which you listed that made this contribution. You will recall that the chairman of the Presidential Task Force on COVID-19 had said on one occasion, and the Minister of Health also, that Nigeria had just about 3,500 bed spaces, which would be inadequate. And as we have seen, with the numbers growing in terms of confirmed cases, we actually need more beds. Certainly. And that was an issue yesterday when, the task force enjoined various states of the Federation to make sure they provide at least about 300 bed spaces, which can be used in the event of the numbers still going up. And here we have this facility in the Federal Capital Territory, 320 bed spaces, which can also be increased to 500. That's a major contribution to the fight against COVID-19. And other persons should emulate this example. It's also interesting that apart from this, yesterday, the Catholic Bishops' Conference donated its 425 hospitals across the country to be used as isolation centers for COVID-19. So this is very commendable, and it shows that whatever may be our travails, Nigerians still have a sense of community and of commitment to the public good.
Absolutely, and fighting against one common enemy. You're absolutely right, Doctor. It's a world-class standard isolation center that comes with a PCR lab. It comes with a medical waste incinerator. It comes with a 98-bed hotel for medical staff for the next 6 months. And really and truly, once again, all commendations to Prince Nduka Obaibena, the chairman of THISDAY Group and Arise Media Channel, and all partners involved. Now, let's take a look at some more news headlines of today. The Nigerian Minister of Health, Dr. Sage Hanire, has said that the federal government and the World Health Organization are carrying out COVID-19 drug trials in the Federal Capital Territory and 5 states of Nigeria. Hanire, who disclosed this at the Presidential Task Force on COVID-19 press briefing in Abuja, listed the states as follows: Lagos, Ogun, Kaduna, Sokoto, and Kano states. Now, the minister confirmed that Nigeria was expecting a herbal drug, COVID Organics, from Madagascar. The drug was reported to have been used by the Indian Ocean Island country to cure patients who tested positive for COVID-19. Also, the PTF chairman and secretary to the government of the Federation, Boss Mustafa, said the President, Muhammadu Buhari, has directed the airlifting of COVID Organics to Nigeria. However, both Hanire and Mustafa said the herbal drug would, of course, be subjected to scientific analysis in the country. According to them, the drug will only be used in Nigeria after it has been confirmed to be safe and working. So we spoke about this for quite a long amount of time yesterday on our news headlines with Mr. Feni, or looking at the newspapers with Mr. Feni. And Madagascar are currently claiming that 55 patients have been cured using COVID Organics, and now we're bringing this product into Nigeria. Of course, it's going to be subjected, like I said, to analysis by our agencies, NAFDAC, etc. However, what's your take on this?
Well, one, I mean, Madagascar has been in the news on account of this herbal remedy.
Yeah.
Don't let me call it herbal concussion. if any says I shouldn't use that phrase. This herbal remedy that they've come up with. And at the moment, Madagascar has not recorded any deaths.
Yes.
It has 186 cases, confirmed cases, and out of that, about 105 persons have recovered. So on the basis of that, Madagascar continues to make the claim that this particular herbal remedy that has been produced by its Institute of Applied Research is something that the rest of Africa can embrace. And hence, you'll find a number of African countries who have received donations from Madagascar. Some of them have bought directly from Madagascar. And the countries that have shown interest include Guinea-Bissau, Equatorial Guinea, Senegal, Chad, even South Africa is offering to help do some of the analysis. However, WHO has said that this particular herbal remedy does not cure COVID-19. Questions have also been raised about those 55 persons that President Handi Rajulina says have recovered, that perhaps these are persons with mild cases, mild symptoms, and that if you have mild symptoms, your immune system can make you recover quickly anyway, and that most of the people who come down with COVID-19, about 90–95% of them in some African countries are actually mild cases.
Yes.
Hanire, the minister, said in Nigeria, actually 95% are mild cases. But it's good that this is going to be subjected to scientific analysis, and that the scientists will determine whether it's the same strain of the virus that is in Madagascar that is also here in Nigeria. There is good diplomacy to accept the donation.
Certainly. I'd like to see where this takes us. The federal government have also said that the plants being used, the base plants for this COVID Organics remedy, is actually a plant that also grows in Nigeria. So let's look into that some more as well at some point. Anyway, we will be taking a quick break on the morning show. That's all on the news headlines. And when we are back, Rota Sodiri, Michael Wilson, and Aaron Akerijola will be here in the next segment to give us updates for today. Stay with us.
Welcome back to the morning show here on Arise News. Joining us now is Rota Sodiri to give us Africa Business Update. Over to you, Rotus.
Good morning,
Dr.
Rotus.
How are you?
Good morning, Leila. Good morning. Coming out of South Africa, this is something I saw that drew a comparison with how we're dealing with the lockdown. A gentleman by the name of Andrew Lappin is the Chief Investment Officer of a company called Allen Gray. And he wrote an article about South Africa's, the lockdown in South Africa and the economic impact of what is happening, what the lockdown is doing with regards to the country. And there's a couple quotes that jumped out. The first of which he said that he worries that South Africa's what South Africa is implementing with regards to the lockdown, he worries about what the economic impact will be and how many lives it's going to cost. So he was essentially saying there's two sides of the same coin. There it is. They're counting the economic cost of South Africa's lockdown. And he says there's two sides to the same coin, the economic costs on one hand and the cost of lives on the other. So he said, I'm concerned that our government's lockdown approach and the subsequent economic hardship inflicted on our people will cost more lives than it can save. And in particular, he then goes on to say that South Africa is a poor country, and as a result of that, we have a very high mortality rate and therefore low life expectancy. But the key part there, him calling South Africa a poor country, from my perspective, as a Nigerian, if you compare both countries in terms of per capita GDP and PPP, which is purchasing power parity, there's a gulf. I mean, you're looking at Nigeria's 2019 GDP of $400 billion, but divided by your population, we've got our issues with census, but take 200 million people, you get a GDP per capita of 2,000. South Africa, $352 billion GDP as of 2019, population of 58 million, GDP capita of 6,000, which is 3 times ours. PPP, you're looking at the productivity of an economy, and we're using a basket of goods to compare the strength of their currencies, the rand versus the naira. So they have a PPP of $13,000, we've got 16,000. So from my perspective, when I see a chief investment officer of a big firm saying that South Africa is a poor country with a high mortality rate and the lockdown is going to have major effects on the economy, then
you question your own country.
Exactly, and I question my own company. How are we going to push this? He then goes on to talk about the economic and human costs being two sides of the same coin. So it's worrisome, and I think that there's going to be some hard questions that we have to answer with regards to where we go forward in having to juggle the lockdown versus the impact on lives and businesses.
You know what? I completely agree with your analysis on that.
But quickly, the position of Andrew Lappin that you have quoted, will seem to be consistent. Many people in the investment sector, in the business sector, they've been questioning across the world, approaches to the easing of the lockdown. In South Africa, what the government has said is that it will take about 6 to 8 months. They want to make it very gradual and be careful. And they've allowed commerce. They've opened up, some commerce. But people like Andrew Lappin, they want the thing to be fast-tracked because of the fears about, the economic crunch, about job losses in particular, because the more you lock down businesses, the more, those businesses will have to deal to rationalize employment figures. Right. And it's the same concern in the UK, for example, where people are complaining about, the exit strategy offered by the Prime Minister yesterday. Right. Manufacturers and the unions are saying the interest of workers have not been factored in. Anyway, thank you, Rotus.
Thanks so much. Rotus. Have a great day. And we're now going to move on for a more global business update in London with Michael Wilson. Good morning, Michael. How are you?
Good morning. Actually, believe it or not, it's May, as we know. It's sunny, but it's frosty. I could not believe it when I woke up this morning. But apart from that, everything's fine. How are you doing?
We're doing good. We're doing good. It's a sunny day in Lagos, thank goodness.
Yeah, well, isn't it always sunny here?
It was raining yesterday.
Asian markets, first of all, we've got this combination of fear, really, and optimism. I think the optimism is very much overplayed at the moment. I was talking to an analyst earlier on in the City of London, and I said to him, so let's, do the puzzle for us. Why are the equity markets ahead of everybody's expectations? And yeah, there was a bit of a wobble on Wall Street last night. There's been a bit of a wobble in Asia. There certainly, I think, will be. You were talking just a moment ago, weren't you both, about the path back to the work and everything, which seems fairly uphill at the moment. Anyway, the long and the short of it is one of the reasons why there's a lot of optimism around. It's a lot of money sloshing around. Basically, we have this infinity QE, the government printing money as much as it can in the United States and also Japan. We've got a certain amount of that here. We've got double the amount in Europe as well. So that's actually, that's really what's powering this. So I would suggest, if I may, that snapshots of the markets are pretty misleading. Underneath it, I think there are many more fundamental things going on. Now, you were talking again about Nigeria GDP. Doctor, forgive me if I'm right or wrong, but I think in either 2012 or 2013, Nigeria became the biggest GDP-driven country in Africa.
That's true.
I thought at the time that everybody was rejoicing about that. What they weren't doing was actually having a look really at the kind of economy that you have. And you were touching on it yesterday, Femi's report with the central bank governor, I thought was very interesting, about the need to diversify the economy away from oil. Because, listen to this, so the CEO of BP is on the front page of the Financial Times this morning, Bernard Looney, a new guy, and he's actually saying, that demand is going down. We may reach peak oil sooner than everybody actually thought. Some people think we've reached it already. I suspect not, but there we go. And he's actually saying that we should watch out for this because, and when you get a major like BP actually saying there's going to be a problem in terms of demand, look at this. I've got the figures down here. 100 million barrels a day, normally down to 30 million barrels a day. That's quite a drop in demand, isn't it? So there's that worry as well. Background also of trade talks which continue. We're going to have the United States and China, well, they haven't reached phase one yet. But again, an interesting thought from an ex-government official here. And I know you're very concerned about the European Union because it is your biggest single export market. Well, it's Africa's second biggest export market. And the EU we would like a deal with the EU. The worry, of course, that we also would like a deal with the United States may not be interested. Continue with European regulation. And then finally, really, apart from the big GDP figures coming at the end of the week, Bank of England economist has warned about the scars. And again, you touched on this in an earlier conversation, which are going to be within the UK economy for a very, very long time. I suspect it's going to be exactly the same with everywhere, quite honestly, globally.
Michael, thank you for today's update. Much appreciated, as always. And joining us now for a global update with regards to COVID-19 is Aaron Akerajala. Good morning, Aaron. How are you?
Good morning, Leila.
Good morning, Aaron.
Good morning, Doctor, this morning.
You said my name with so much tone today.
Isn't that what he does all the time?
It sounded normal, like Doctor just said.
He's warming up. Very soon he'll start writing poems for you.
No. Those are reserved.
That's an exclusive preserve.
That's reserved for Tunde.
Okay, let's get straight into the numbers. But quite frightening as news is actually broken concerning what is happening in Ghana. Now, Ghana has actually overtaken Nigeria as the 5th highest case state in Africa. Looking at Africa's figure in general, you get to find out that at the moment, we have about 64,214 with 2,293 deaths and recoveries of 22,243. But now the big story has been the fact that a particular fish market in Ghana has actually seen one person infecting 533 people. And it has gotten Ghana very worried because at the moment, when you look at the figures in Ghana, 4,700 people have been infected with coronavirus. But the good thing is this, Ghana have been doing quite a lot of testing. Over 161,000 tests has been done, well over that, and just 22 deaths have been recorded. So a lot of plaudits must be given to Ghana. And also, this seems to be a good thing because understanding that if you have tested over 161,000 people and you can only just record just 22 deaths, as against Nigeria, we have actually, at the moment, our death rate is actually still high, 150 deaths from cases of 4,641. You look at that and you say to yourself, what a way.
Death by population, though, also has to be taken into consideration.
Ghana has been in the news, and the president, Nana Akufo-Addo, addressed the nation for 21 minutes on Sunday, and that was when he disclosed these 533 new cases in Tema, the port city of Tema. However, what should be noted is that he said these were part of samples that have been collected before April 26. Now, what they now did was they completed all this testing, and they found that out of the 956 samples that they had, up to about 533, and that was traced through gene sequencing to a factory in Tema. Because a lot of people have been saying that it's because of the easing of the lockdown in Ghana that we see the numbers spiking. And the president clarified that and said, no, that is not the reality. And he talked about testing, the number of tests that they have done. And Ghana, within the West African region, has the highest figures per million in terms of testing. Another point he made, which is a major takeaway from that is broadcast, is that, look, nobody should politicize COVID-19, because there has been, this altercation between the ruling party and the main opposition party, and he was saying, look, the opposition people who are criticizing his government, they are doing so because they want to be relevant, because of their own political survival. And we've been saying, either in Nigeria or Ghana, there should be solidarity across all levels. There shouldn't be partisanship involved in the fight against COVID-19.
Certainly, but I think this also shows a lot of fragility with COVID-19. It shows how easy a super spreader can be, or how easy a super spread can be, how easily one person can infect so many people. The same situation happening in South Korea, where somebody went to a couple nightclubs that opened, and now they're trying to contact trace hundreds of people to find out who is infected. So it's so easy for you to see a sudden spike again with coronavirus if you do not take things as seriously as you should.
Yeah, because you've been, like Doctor said, like you always say, this is a common enemy, all right, alluding to what you've been saying concerning fighting this thing together. But more importantly, people don't take social distancing very seriously. They think coronavirus probably is in one area of probably a city or another. It is everywhere, and somebody might be carrying it. It might not show any infections and anything. It might be asymptomatic. And you look at all those things, and this is a sign, massive sign, I must actually say.
It is.
Thank you, Aaron.
Thanks for today's update. We'll see you tomorrow.